It is day 2 of Tick Week. Yesterday we showed you where deer ticks are emerging in Maine and which new species are knocking on our door. Now health officials are warning about a sharp rise in cases of a rare tick-borne disease that can be more severe than Lyme.
That one is called babesiosis, and the U.S. CDC recently added Maine to a list of New England states where the potentially deadly co-infection is making inroads now. News Center Maine's Vivian Lee shows us how infections are being tracked and the symptoms you need to look out for.
The U.S. CDC says cases of babesiosis has skyrocketed in Maine since 2014. The symptoms can mimic Lyme, but it is treatable if caught early. But for one Maine family, this rare tick-borne illness has turned their lives upside down.
You can put it on that.
In this household, 3 generations have been greatly impacted by tick-borne illness.
Muscle soreness, the headaches. I had eye sensitivity.
Brenda Leclerc, her daughter Mallory Rich, and 2 of her granddaughters, Paige and Hope, have Lyme and multiple co-infections, including babesiosis. Each had different symptoms over a several-year span dating back to 2015. Brenda had severe respiratory problems, while some left Mallory, a mother of 3, not able to get out of bed.
I had a lot of neurological issues. My heart was impacted. I had heart palpitations.
Paige had digestive problems, but she, her mother, and her grandmother are improving thanks to naturopathic treatment. For this family, though, it's been an incredibly difficult journey to get the correct diagnosis and treatment after each initially tested negative for Lyme and other tick-borne infections on standardized blood tests. You feel like if you hadn't gone and sought out your own health care and advocated, it'd be a different story, because
I'm not sure I'd be here today.
babesiosis and anaplasmosis, which experts consider rare, are now on the rise in Maine. Like Lyme disease, both diseases are transmitted by deer ticks. According to the U.S. CDC, babesiosis has skyrocketed in our state from 9 reported cases in 2011 to 138 in 2019. In 2022, there were 192 cases of babesiosis. Dr. Scott Melton treats infectious diseases at Northern Light Infectious Disease Care. He says babesiosis can include fever, chills, lethargy, joint pain, and body aches, symptoms that can overlap with Lyme, but there is not a distinct bullseye rash. Because of the similarities, he says, a correct diagnosis can be tricky. While Lyme and anaplasmosis can be treated with a course of antibiotics, doxycycline, that's not the case for babesiosis.
Unfortunately, Babesia doesn't respond to that antibiotic. It needs another antibiotic. So the idea is, if you're treating your patient and they don't get better in a few days, maybe think about it being Babesia and possibly treating them for Babesia.
The disease can cause a low red blood count, while anaplasmosis attacks the white blood cells. In extreme cases, if left untreated, both illnesses can cause acute respiratory failure, heart, liver, and renal failure, and death, especially in elderly patients who have compromised immune systems.
If you're older, have comorbid conditions, if your spleen's not working like it should, well then yeah, we need to go ahead and treat.
It's not a surprise to those of us working with ticks and tick-borne illnesses. We've seen cases of babesiosis here in the state of Maine dating back to about 2000, 2001.
Griffin Dill manages the University of Maine Cooperative Extension Tick Lab, where researchers have been tracking babesiosis in Maine for more than 2 decades. Dill says cases were about 5 to 10 a year until 2013, when the numbers jumped to about 30 to 40 a year.
Now we're seeing, a couple hundred cases of babesiosis in the state of Maine.
Dill says that number could be even higher because cases go unreported. Dill says anaplasmosis is regularly occurring in the community, with cases also on the increase. The Maine CDC first reported a 600% spike in cases of anaplasmosis in 2017 over a 3-year period, and that trend is continuing, with 822 cases last year. Researchers say exposure to deer ticks are also putting more people at risk for all of the co-infections, not just Lyme.
1 to 2% of the ticks we test for are co-infected with all of the pathogens.
As for this family, Brenda says it is heartbreaking to see her granddaughters and daughter be ravaged by tick-borne infections, but the family always takes precautions.
We always do tick checks. The girls have done it their whole lives. We've always looked for ticks, and we know to look behind their ears and in their hair.
Now, the U.S. CDC report only underscores the importance of protecting yourself, your family, and your pets before heading outdoors. And if you do find an attached tick, try to remove it immediately, call your doctor. and send it to the University of Maine Tick Lab for testing. For Tick Week, Vivian Lee, News Center, Maine.
Coming up tomorrow for Tick Week, we'll tell you why a number of patients, also some healthcare providers, are pushing the state to require labs to provide more data on standardized tests for Lyme.
We have all the Tick Week stories so far, plus important information on tick-borne illnesses on our website and our News Center Maine app.